Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in the very interesting class of Roga Nidan subject. My dear friends, Roga Nidan subject, it is also called as a Roga Nidan Evam Vikriti Vidnyan. Roga Vidnyan, understanding the science of disease, and Vikruti Vidnyan. Vikriti is a pathology. Vikruti is a pathology. And in this, we are studying since last three classes, we are making for Nidana Panchak. 5 things are there to understand the proper disease. When we want to understand the disease, that is Nidana Panchak. That is Roga Pariksha. Roga is a disease. And what is Rogi Pariksha? Rogi is a clinical examination of the patient. Rogi is a patient. So there is a Trividha Pariksha, Chaturvidha Pariksha, Ashtavidha Pariksha, and Dashavidha Pariksha. I will repeat. Trividha Pariksha, Chaturvidha Pariksha, Ashtavidha Pariksha, and Dashavidha Pariksha. So this is related with the clinical examination of patient. Patient is Rogi. Now we are studying Roga, that is disease, Nidan Panchak. So there are 5 things. Nidana, that is a etiology or the causative factors. Puru Rupa, Upashaya, Anupashaya, together. Upashaya and Anupashaya. And today we are going to see Samprapti. So please write down title of the subject, today's date. Write down the date. 4th of December 2023. And the topic, bold. Samprapti. Samprapti, here, you can see the cursor. Samprapti. But there, into bracket or dash, you write down pathogenesis. Please write down Patho. Pathogenesis. Genesis. Pathogenesis. How the pathology takes place. How the abnormality takes place. What are the different steps in the process? The person is exposed to the causative factors. Then dosha prakop is there. And then prakupita dosha, they move here and there in the body. And they try to find out where I can attack. Dosha wants to attack. Attack on what? Either dhatu or mala. Prakupita dosha, write down. Prakupita dosha will attack on weak, W-E-A-K, weak dhatu or weak mala. Which are the dhatus? Rasa, rakta, mas, med, asti, majja, shukra. So doshas are finding where I can attack. And then they attack, and then 2 things are coming together. Prakupita dosha and weak dhatu and mala are called as dushya. Please write down the word D-U-S-H-Y-A. What is dushya? The weak dhatu, weak mala, they are called as dushya because they are get attacked from the prakupita dosha. So what is final thing is happening? Dosha here and dushya sammurchana. Dosha dushya sammurchana. Dosha dushya sammurchana. This word is important. Dosha dushya sammurchana janito vyadhihi. You are expected to write dosha, D-O-S-H-A, dushya, D-U-S-H-Y-A, sammurchana. A little complicated word. S-A-M-M-U-R, sammurchana, C-H-A-N-A, sammurchana. That is bad union, bad. Not good. Because these doshas are prakupit, these are weak. So combination. Sammurchana, janito, J-A-N-I-T-O, janito, vyadhihi. It creates a disease. So how disease is created? dosha, dushya, sammurchana, janito, vyadihi. But this doesn't happen instantaneously in 1 second, no. For example, this is the Hemanta Rutu, winter season, thanda, thanda, cool, cool, cold, but still some people eat ice cream. Are you getting my point? Ice cream, a lot of ice cream. This is bad, not good. So kapha will be dushta. Kapha and vata, because vata is a shita, kapha is a shita. Am I right? So there will be kapha prakop or vata prakop. Now, this vata and kapha prakupita, they will move in the body here. And then they find, this person has the asthi dhatu is weak. This 60 years old person is not drinking milk, calcium deficiency, osteoporosis. So his knee joint is weak. So vata and kapha attack on knee joint. And what the patient starts? Sandhivata. Are you getting my point? Vata kapha dosha are attacking on the dushya asthi dhatu, mausa dhatu, and sandhivata will be created. But if some person has problem in the rasa dhatu, his asthi are okay, but rasa dhatu is not good, then they will attack on rasa dhatu. So what will happen when the vata dosha is attacking on rasa dhatu? There will be palpitation, heart. Rasa dhatu is concerned with the heart. So there will be loved up fast, tachycardia. Or, so they will attack on the mausa dhatu. Hruday, heart muscle, they will attack on the heart muscles. Rasa dhatu is also connected with the heart. And rasa dhatu problem will start. Sometime it will affect the rasa dhatu and samata will be created. Indigestion will start. Abdominal problems will start. Pain in the abdomen. Because rasa dhatu is weak. So the same dosha will try to find out where is the problem, where is the weak tissue, and they will attack dosha, dushya, sammurchana, janito vyadhi. Okay, so this whole process of pathogenesis, shatakriya kal, chaya, prakop, prasara, sthana samshray, vyakti, bhed, whole process is together. Together is called as a samprapti. Okay, let us see. Yatha dushtena doshena, yatha cha anuvisarapata, niruttir amasya sampraptir jatiragati. Vagbhat, Ashtangrude is Vagbhat. So, process of, you can understand by, I'm sorry, I will mark that if possible. Process of understanding the development of disease by vitiated doshas which are constantly circulating inside the body. Yatha dushtena doshena. How the doshas are dushta, prakupita, that we have to find out. Yatha cha anuvisarapata, where they are moving, on which dhatu they are attacking. And niruttir ama. That means expression of the disease. Disease will be diagnosed by understanding the causative factor of the dosha prakop and understanding the movement of the dosha inside the body where they are attacking. So whole this process will be understood by samprapti, and there are synonyms. Another names for the samprapti word, jati is equal to samprapti, agati, samprapti. Jati and agati are the two words for this samprapti. These are the synonyms. Please write down samprapti synonyms. Dictation. Write down, start writing. First word is samprapti. What is another word? Jati. Can you see the cursor? Jati. I am moving this cursor so that here, can you see? Jati. Next, you write down, I will wait. Agati. Agati. Then nivrutti. The different names for the samprapti. And nishpati. Nishpati. So these are all 5 different words or the names for the word Samprapti. Now, Samprapti Bhed, very important topic. Write down dictation, Samprapti Bhed, that is in English types of Samprapti. Don't write in Sanskrit. No, only this. Samprapti. Bhed means types. Write down types of Samprapti. Charak Nidan Sthan. You write down Charak Nidan Sthan. Chani. Ni means Nidan Sthan. Chapter 1. Huh? So you have so write down 1, 2, 3. Here the pointers are there, but you give the numbers. First Samprapti is Sankhya Samprapti. Please write down. Number 1, Sankhya Samprapti. Sankhya means, write down. Sankhya is equal to numbers. 1, 2, 3, 4, 5 numbers. Sankhya Samprapti. Second, Pradhanya Samprapti. Write down. Pradhanya Samprapti. Who is more important? Pradhanya. That process is more important. Pradhanya, apradhanya. Primary, secondary. Very important. Pradhanya. Vidhi Samprapti. Vidhi. The name is Vidhi. Then Vikalp Samprapti. We are going to see each and everything. But give the numbers. First is the Sankhya Samprapti. I will wait. Second, Pradhanya Samprapti. Fast handwriting. Fast. Third, Vidhi Samprapti. Fourth, Vikalp Samprapti. Fifth, Bala Samprapti. Bala. And sixth, Kaal Samprapti. So different types are 6. Write down number 6. 6 Samprapti. 1, 2, 3, 4, 5, 6. Sankhya Samprapti. Pradhanya Samprapti. Vidhi Samprapti. Vikalpa Samprapti. Bala Samprapti and Kaal Samprapti. Let us start to discuss each point. Give the title, Sankhya Samprapti. Here, we just understand how many numbers that means how many types of the diseases. For example, can you see? Ashtau Jwaraha. Ayurveda explains Jwara, that is a fever, 8 types of Jwara. So when we understand the number, how much number is the types of the diseases, then it is called as a Sankhya Samprapti. Sankhya is related with number. So you remember only these 3 examples. Write down 3 examples. Number 1, 8 types of Jwara. Don't go for Sanskrit. I will request you. No, not necessary. Only you see this one. Here, can you see the cursor? 8 types of Jwara. Jwara means fever. 5 types of Gulma. 5 types of, can you see here? Again, I will try to mark for you. Yes, come on. 5 types of Gulma. Tumor. Gulma means tumor. 5 types of Gulma and 7 types of Kushta. Cursor, can you see the cursor? Write down. Kushta means skin diseases. Here, only we are understanding in numbers. So this type is called Sankhya Samprapti. Finish. That is Sankhya number. Finish. Sankhya Samprapti. Next. Pradhanya Samprapti. Don't read Sanskrit. No, not necessary. Not necessary. Okay. We will try to understand what is Pradhanya Samprapti. Pradhanya means who is main. Who is main? Chief. It helps the identification of dominant dosha in case of 2 or more doshas are involved. Okay. In case of 2 doshas, the word tar is used to denote a dominancy in comparison to the other doshas. In case of the 3 doshas involved, the word tama is used to demonstrate its dominancy with other 2 doshas. I will explain you. No matter. Don't worry. Be happy. Okay. So what is tar? For example, if I have the fever, you can write down the example, fever. Okay. This is Vata Kapha fever. What is the name? Vata Kapha. But Vata dominance is there. So Vata is comparatively more. Tara means comparatively more. Okay. So Vata Pradhana Kafanubandhi Jwara. How I will write? Vata Pradhana Kapha Anubandhi Jwara. Vata Pradhana Kapha Anubandhi Jwara. That means Vata is a primary and Kapha is a secondary. So patient will have more and more body ache. Little cold, little cough, little, not much. Kapha symptoms, less. But severe body ache, viral fever. Okay, so that is Vata Pradhana Kapha Jwara. Kaphanubandhi. Vata Pradhan Kaphanubandhi. Jwara. Vata Pradhan Kaphanubandhi Jwara. So that is comparison in two. Now here, Tama. So if one dosha, for example, again we will take the same example, three dosha jwara is there, but Vata is a Tama. Tama means extremely predominant. Vata dosha's qualities are disturbed 80%. Pitta only 10%, Kapha only 10%. So in three doshas, that Vata problem is extreme problem, that is Tama. Tama is not darkness, Tama is extreme. Tara means comparatively in between two comparison. But Tama is in three doshas, this is the top. And another two are very low. That is Tama. I hope that you are getting this point. Okay, next we will go for the... This is Pradhanya and secondary, primarily and secondary. Which dosha is predominant? Next is a Vikalp Samprapti. First you write down at least titles. It is very easy to remember. Vikalpa. Vikalpa. Again, not necessary to read the Sanskrit lines, but we will try to concentrate or hear. Okay. This indicates the proportional analysis of the qualities of the doshas involved. In case of Vata involvement, whether Samana Vayu problem is there, or Vyana Vayu problem is there, or Apana Vayu problem is there, which Vata, whether Prana, Udana is involved in singly or in mixing with the two doshas. That means, for example, if I have the bronchial asthma, so there is a Prana Udana deformity. Prana and Udana Vayu both, because Prana is Anulomana Gati, inspiration, and Udana is expiration. So both are problematic. So this is called as a Prana Udana joint problem. So we have to decide only one type of the Vata dosha is involved, two types or three types. That we have to, that is called as a Vikalpa. Different options are there. Okay. Then, involved in singly or mixing two doshas, such observation can be understood by the knowledge of Vikalpa, options. Write down the translation. Vikalpa means option. Then, Vikalpa Samprapti also help to detect the qualitative or quantitative or functional aggravation of the doshas. For example, Sheet, cold, vitiates Vata quickly than Laghu Guna or Ruksha substances. So, Shita Guna is more predominant to disturb the Vata dosha with compared to the Chala and Rukshata. In Prameha, for example, can you see? Dravansha Dushti is there. In whole of our body, Jala Mahabhut, clay, the formation is there. So that is called as a Dravansha. Tejansha, Ghanansha, which Mahabhuta is predominantly problematic. So Dravansha, clay is problematic. In Amla Pitta, again there is a Dravansha Dushti. Pitta has a different properties. Pittam, Sasneya, Tikshnoshtam, Laghu, Vistram, Saram, Dravam. So there is a Drava Guna, Tekta Dravatvam Pakadikarmana. And Ushnata is increasing. Are you getting my point? Because Amla Pitta is there. So that means we have to find out which property of the doshas is disturbed. This sentence you can write down. While examining the patient, while examining the disease, we have to check that particular disease is happening, is occurring by which property of the dosha is disturbed. Which property? I will give you some examples so that you can understand. so that you can understand. Okay. Suppose one patient comes to me and he is complaining that, doctor, I have a lot of shivering, feeling too much cold. So I can definitely understand Vata has a different property. You have to write down in the examination all the Vata properties. Tatra ruksho, laghu, shitaha, khara, sukshmaschalo nidaha. Ruksha, laghu, shita, these are the properties of Vata dosha. But when patient is telling that I am feeling cold and shivering, naturally, it is not because of the Ruksha guna. It is not because of the Chala guna. It is because of the Shita guna is more predominant. After that patient, another patient comes to me. And he is telling me, doctor, I have palpitation. You can write down these examples. Palpitation. Dhakka dhakka karne laga, heartbeats. Usually we don't hear our own heart sounds. But when there is a tachycardia, arrhythmia of the heart, then the patient himself can understand there is a beating of the heart. In Ayurveda, it is called as a Rudra Drava. Palpitation, Rudra Drava. And here, which property is disturbed? Hita, Shita, or Ruksha, or Laghu, or Chala? Definitely Chala guna. Arrhythmia is concerned with the Chala guna. Because of the hectic lifestyle, because of a lot of thoughts in the mind, tension, anxiety, Chala guna is disturbed and he has a palpitation. So in the first patient, the Shita guna was disturbed. In the second patient, Chala guna is disturbed. Third patient comes to me. I am sitting in my clinic. Third patient comes to me. He is saying, doctor, see that I have a lot of cracks. My skin is very, very dry. Can you see, doctor? A lot of cracks are there. My feet is also cracking. Cracks, you know the cracks. Now I will think, Vata dosha is there. Shita guna increased? No. Chala guna increased? No. Laghu guna increased? No. Then what? Ruksha guna has been increased when there are cracks. Ruksha guna, dryness. So this diagnosis, whether the Shita guna is increased, whether the Chala guna is increased, whether the Ruksha guna is increased. Fourth patient, you can give this all four examples in the examination. Fourth patient comes to me. Doctor, last 1 month, I am losing my weight. I am losing my weight, doctor. What is happening with me? I don't know. And I can't eat much more because I am not feeling eating. So I will think, is it a Shita gun problem? No. Is it a Chala gun problem? No. It is a Ruksha guna problem? No. Weight loss, that is Laghu guna is a problem. So here in the fourth patient, Vata Laghu guna is disturbed. So to understand the difference, which property, that is called as a Vikalpa. Different options are there for diagnosing the disease. I hope this is the best examples that I have given you. 4 examples that you can write in the Vikalp Samprapti. Next, Vidhi Samprapti. Vidhi means variety of diseases. Variety of diseases. For example, 2 varieties are Nija and Agantu. Nija, write down, Nija, endogenous. Problem is inside your body. Dosha Prakop is first. And then he is attacking, doshas are attacking on dhatus. So problem starts from inside, that is Nija. But when you have any road accident, that is Agantu Vyadhi, traumatic, from external. So there Dhatu Dushti is predominant and then Dosha Dushti occurs. When the Vyadhi is coming from inside, Nija from inside, Agantu from outside. Agantu from outside. In Nija Vyadhi, Dosha Dushti is first and then Dhatu Dushti. In Agantu, I have the fracture. So, Dhatu Dushti, my Asthi Dhatu has been broken. Asthi Dhatu is first and then the pain starts. Then Vata Dushti. Then Dosha Dushti. I think reverse is there. Nija inside, from inside. That is Nija Vyadhi. And from outside, Agantu Vyadhi. That is trauma. Trauma, road accident, scooter accident. That is trauma. Agantu. Then two varieties, Nijagantu, three varieties of dosha based on their vitiation. For example, Vataja diseases, Pittaja diseases, Kaphaja diseases. Three varieties are there. So this is Vidhi. Vidhi means the different types. Then four varieties of the diseases based on the prognosis. Sadhya, Sadhyatva. I have already explained this. Sadhya and Asadhya. These are the two types. Sadhya means curable. Asadhya, non-curable. Cancer. HIV last stage. Incurable. But cold, cough, bronchitis, curable. Sadhya. But I have given you the differentiation. I think it was in Charak or I don't remember. But Sadhya has two types. Sukha Sadhya, Krichra Sadhya. In Asadhya, there are two types. Yapya, Anupakramya. I think you just revise with the videos, okay? Then Mrudu, a little bit comfort. That means not serious disease, but Daruna, oh my God, OMG. Serious disease, Daruna. Okay. Bala Samprapti, Kaal Samprapti. Two types, Bala Kaal. Bala and Kaal different. Understanding the strength of the disease based on the causative factors, area of involvement organ, which organ has been affected, age, helps to assess the strength of the disease. Again, I will give two examples. Write down two examples. Bala Samprapti. That means which disease is powerful. Write down which disease is powerful. Which disease is powerful? I am giving you two patients. First patient comes to my clinic. He is a very stout, sturdy, young person. 25 years old patient. 25 years, but very strong in muscles, bones, everything is okay. And he has got the backache. Are you getting my point? And because he has to sit for longer time for the computer and all these things, so he has started backache. This is first case. Then second patient comes to me. He is an old person, right now, 70-year-old. 70-year-old. All the skin is dry, very weak person. His blood reports showing calcium is less, vitamin D is less, and he is having the backache. So which first patient disease is more powerful or the second person's disease is more powerful? I think naturally second patient, because he is having old age, so cure is difficult. He has a vitamin deficiency, calcium deficiency, all these problems are there. He is always having a dryness. So his problems will be difficult to cure. So his disease is more powerful. Bala of his disease is more powerful, and Bala of that young chap. Just I will give some example. Do the yogasana, apply the abhyanga massage. But he is already strong. So his disease will go away. So this Bala is less. But that Bala of next patient having the strong problem. So Bala, that means that Bala of that disease with the old person is more serious, and Bala of this first young person is less. Bala of the disease, Bala of the backache, Bala of the Prushta Shula. First one less Bala, second one more Bala. More Bala means more, the disease is more strong. So the cure is difficult. When the disease is strong, cure will be difficult. When the disease will be strong, cure will be difficult. Write down. Or you can hear audio all the time. Okay. Next, Kaal. This indicates the time of aggregation of the doshas in relation to the season, various time of the day, night, and intake of the food. For example, Kafaja Jwara in Vasanta Rutu. You tell me whether it is easily curable or difficult to cure. Common sense. Vasanta month, Vasanta Rutu, Vasanta season, spring season, write down this example. Kafaja Jwara in Vasanta Rutu. Kapha Jwara aggravates in forenoon and early night. Kafaja Jwara aggravates after intake of food. Forget about all these things. Just tell me if the Kafaja Jwara is having in the Vasanta Rutu, is it more difficult to cure, or was Kafaja Jwara in Grishma Rutu is more difficult to cure? Actually, Jwara in Grishma Rutu is difficult to cure, but Vasanta is a Kapha Prakopita Kaal, Kapha Prakop Kaal. So at that time, Kapha dosha is also increased, and season it is also giving stimulus to that particular Kapha dosha. So it's Kapha plus Kapha. Kapha dosha Prakop and Kapha season is there. So that is more problematic. But in the second case, Kapha dosh is there, but Grishma Rutu is there. So it is comparatively easy to treat. Comparatively, I am saying comparatively. Not because Jwara is always difficult to cure. But Kafaja Jwara, having a lot of cold, cough, full chest is rahals and rankai, rahals especially, crepitations, lot of cough in my chest, the small babies that, and he is having Vasanta Rutu, difficult to cure. Because lot of strong medicines I will have to use. Even I have to give the Vamana. But if that child is having cold cough, but the season outside is summer, so I need not to give strong medicine. It is automatically only warm water or so simple ginger medicines that will okay. Because environment is not favoring, that whole atmosphere is not favoring to the disease. I hope you are understanding how the Kaal is affecting your disease. Another example, let us take another example. If I am having bleeding problem, and that too, especially for example, if I am getting hematemesis, esophageal varices, if that problem is more in the Sharad Rutu, and if that problem occurs in the Hemant Rutu, which one will be difficult to cure? Bleeding, hematemesis, bleeding through the vomiting is a Pitta problem, Rakta Dhatu problem. So Pitta, Rakta Dhatu is there, and Sharad Rutu is a Pitta Prakop Kaal. So it is more difficult to treat this patient. But if it occurs in the Hemanta Rutu, comparatively, okay. Comparatively, I am again saying. So Kaal is affecting the treatment part also. That is called as a Kaal Samprapti. That we have to understand which Kaal is there and how it is affecting to the disease. Now, utility, the Samprapti part is little bit over. Make an end line. Now, especially new question has been started in the examination. They will ask you, tell us the utility, how that Nidan Panchak is useful. Tell us. This is another question. Huh? Okay. The qualified physician with his own pure mind, logical thinking and wisdom should examine the disease. Remember, can you see? Examination of not patient, examination of disease, that is Nidan Panchak. Examination of disease, Nidan Panchak. Roga Pariksha, Vyadhi Pariksha, Nidan Panchak. Rogi Pariksha, Rugna Pariksha, Patient Pariksha. Which are those? Which are those? Trividha Pariksha, Chaturvidha Pariksha, Ashtavidha Pariksha, Dashavidha Pariksha. In the previous videos, you just check whichever the upper part there is some signal is coming. There I have mentioned Dashavidha Pariksha. You please see that video very carefully. Very carefully. Dusham, Desham, Balam, Kalam, Analam Prakritim Vayaha, Sattvam, Satmyam, Tatha Aharam, Avasthascha Pruthak Vidaha. Oh, sir, a big shloka. Don't worry, be happy. This is not today's topic. I'm just giving you the revisions of another topics also. Dashavidha Pariksha. Okay. Vaidya, qualified physician, own pure mind and wisdom, should examine the disease with the Hetu. Nidan Panchak, Pururupa, can you see here cursor? Lakshana, that is Rupa. Lakshana, Rupa. Upashaya and Anupashaya, fourth, and Samprapti, fifth. In order to diagnose the disease to the best of the knowledge and henceforth proceed with the treatment. After diagnosing the disease, let us start to treat the patient. All the diseases are caused due to the Kupita dosha, Prakupita dosha, initiated by the Nidan, Hetu Sevan, Nidana Sevan. If you make a lot of exercises, faster running, hectic lifestyle, very busy, which dosha will Prakupita? Vata dosha will Prakupita. Exactly, good. If you are eating a lot, high calorie food, fatty food, fried bhaji, vada pav, all the time. Heavy food, fatty food. Which dosha will Prakupita? Yes, Kapha dosha will Prakupita. Another patient eating lot of chili only, green chili, red chili, tamda rasa, hot and pungent, pickles all the time, chutney all the time. Which dosha will Prakupita? Yes, Pitta dosha will Prakupita. So we have to see this, which causes are there and how they are affecting. Similarly, the dosha prakop is also caused due to the various factors which primarily include the non-beneficial substances classified as asatmi indriyartha sanyog, pradnyaparad and parinam. My dear friends, I will wait for even 5 minutes, but these trividha karana, trividha hetu, trividha causes are very important. So these three names, 1, 2, 3. But first give the title. Trividha hetu, Trivadha, Trividha, Vidha, hetu, Hetu, Trividha hetu. Give the title. Start writing. Trividha hetu. I will wait, no problem. Trividha hetu. And then you write down every on the separate line. First number here. Can you see here cursor? See the cursor. Cursor, I am moving. Here cursor, you have to see. Asatmya indriyartha sanyog. Very big word. Asatmya indriyartha sanyog. We have discussed all this. You see the videos. Huh? Second, pradnya aparadh. Pradnya means intelligence. We are doing wrong things with the wrong time. We are not using our brain. Then we are becoming ill. Common sense is uncommon. Write down. Common sense is uncommon. That's why pradnya aparadh. But if you want to hear very interesting shloka, just hear. Don't write, just hear. What is pradnya aparadh? Dr. Deshpande is telling shlok. Come on. Dhi, dhruti, smruti. Dhi, dhruti, smruti, vibrashtaha. Vibrashtaha yat kurute ashubham pradnyaparadham tam vidyat sarvadosha prakopanam. I am telling the shloka of pradnyaparad. You can find out in your textbook. Dhi, dhruti, smruti. Dhi, dhruti, smruti, vibhraush yat kurute ashubham pradnyaparadham tam vidyat sarvadosha prakopanam. That is pradnyaparad. And parinam, third line. All line you have to separate. First, asatmindriyartha. Second, pradnyaparad. Third, see here, parinam. Write down parinam. Into bracket, write down Kaal. Just now we have seen Kaal. Seasons. Huh? So all these things we have to consider in Nidana Panchak, and that is beneficial to diagnose the disease. Samprapti Ghataka. Write down. Samprapti Ghataka. Samprapti is what? The story of a disease. Narration. From the causes to the final disease. Like a story. Narration goes from intake of etiological factors, that is causes, up to the manifestation of disease. As in a story, there needs to be certain characters also participate in the causation of disease, in the causation of some another factor. These characters form the ghatak or component for the manifestation of disease, and they are called as a samprapti ghataka or vyadhi ghataka. These components which participate as a group in the formation of disease are called as a samprapti ghataka. This is the most important question for your examination. Very important. SAQ, write down SAQ, short answer question for 5 marks. And what they ask? Describe Vyadhi Ghataka or Samprapti Ghataka. You write down both the words. Describe Samprapti Ghataka or Vyadhi Ghataka. Very important question for the oral, for the written. Have you written describe or write Samprapti Ghataka or Vyadhi Ghataka? Now we have to write down all these things. We have a lot of time today. We will go slowly, steadily, but don't make these marks. You write down numbers. You write down numbers. So we will count. For example, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Nearly 13 Vyadhi Ghataka are there. 13, 1, 3. Write down number 13. First number, write down slowly. Dosha. Vyadhi Ghatak. Because when Vyadhi, there must be Prakupita dosha. Either it may be Prakupita Vata, Prakupita Pitta, Prakupita Kapha, or maybe Vata Pitta, Vata Pradhan Pittanubandhi, Pitta Pradhan Kaphanubandhi, primary, secondary, etc. But dosha should be there. Next, write down numbers. Numbers are 13 numbers. I will ask you next time. 13 numbers Vyadhi Ghatak or Samprapti Ghatak. Very important question. Number 2, Dushya. What is Dushya? The doshas are attacking on the Dhatu and Mala. So Dhatu and Mala are called as Dushya. You write down only these things. Huh? Don't write any other thing. Just I am going on again discussing. You remember when we start this today's lecture, how the Vyadhi is generated? Is anybody remembering how the Vyadhi is generated according to Ayurveda? Anybody? Yes. Dosha, Dushya, Sammurchana. Janito Vyadhihi. Dosha, Dushya, Sammurchana. Janito Vyadhihi. So here Dushya. Next. Cursor. Agni. Yes, Agni is very important. English medium, digestive fire. But better way, write down Agni. Agni is better. Digestive fire. You remember the types of Agni? Yes. Jatragni. Here in the abdomen. Dhatvagni. Panchabhutagni. All the Agni types are there. So anything can be disturbed. It may be Jatragni problem. It may be Dhatvagni problem. It may be Panchabhutagni problem. Ayurveda says very important. Whatever, you only concentrate here. Only you have to write down 13. Don't write any other thing. I am just speaking and speaking. What is the Ayurveda statement for Agni? Rogaha sarve api mandegnam. Rogaha sarve api mandegnam. All the diseases, yes, all the diseases from cold to cancer, Dr. Deshpande is saying, everything is because of the Agnimandya according to Ayurveda. Faulty metabolic process. Simple translation. Next, fourth one. Ama. What is ama? Write down, is equal to toxin. How it is created, that toxin? Because of the indigestion. Non-digested part becomes the toxin-like substance which is called Ayurveda Am. Am, very important concept. That makes the Srotorodh. Am, Sam Vat, Sam Pitta, Sam Kapha, Niram Vat, Niram Pitta, Niram Kapha. These 6 shlokas are very important. Please write down. This is homework for you. Please write down homework. Write or describe Sama Vata Lakshana below. Nirama Vata Lakshana. Sama Pitta Lakshana. Nirama Pitta Lakshana. Sama Kapha Lakshana. Nirama Kapha Lakshana. 6 shlokas are very important for whole life. So that is Ama. Then Srotas, we have learned each and every Srotasas. Do you remember? Sroto Dushti Hetu, Sroto Dushti Lakshan. You remember? Srotasa Mula Sthana. In our body, innumerable Srotasas are there. Very, very, too much. We cannot count. Yavanto hi loke bhava visheshaha tavantaha Srotasam prakara visheshaha. Forget. Don't take tension of Sanskrit. But 13 Srotasas are important. You remember the names? Prana, Anna and Udak. Prana va Srotas, Anna va Srotas, Udaka va Srotas. Sapta Dhatu Srotas, Rasava, Raktava, Mansava, Medava, Astiva, Majjava, Shukrava, Srotas. What else? Yes, Mala, 3 Mala. Mutrava Srotas, Purishava Srotas, Svedava Srotas. In the female, 3 more. Artava Srotas, Stanyava Srotas. All Srotasas are important. Sroto Vaigunya, Sroto Dushti, I have discussed. See the video, okay? Sroto Dushti Prakar. How Ati Pravrutti, exacerbation, Sira Granthi, Sangha, and V Marga Gamana. Ati Pravrutti Sangova, Siranam Granthayopi va, V Margamanam Chapi, Srotasam Dushti Lakshanam. So you have to remember that shloka. Go open your textbook and read this shloka. Sroto Dushti Lakshana. Ati Pravrutti Sangova, Siranam Granthayopi va, V Margamanam Chapi, Srotasam Dushti Lakshana. Then Udbhava. Site of origin of disease. Where it is started, which is the basic factor. So where it has been started. Then Sanchara Sthana, where that Prakupita dosha is moving in the body. Sanchara Sthana, places where the doshas or disease will spread. I can give a very serious example. Udbhava Sthana. For example, one lady comes to me with some nodule in the breast, and because of the that particular mammography and also biopsy, I have diagnosed that the lady has a breast cancer. But at this stage, that is cancer in situ. Cancer in situ, I have explained this. That is called as Udbhavasthan. But after few years, that cancer cells, if not treated properly, may spread. I am not saying 100%, may spread to the other parts, which is called as a metastasis. That is pressure of the disease. Moving. Next. Sancharasthan, Vyaktasthana, where actually final manifestation of the symptoms takes place. Roga Marga, very important word. You are giving the numbers. Huh? This is 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Doshagati, 10th number. Urdhvagati, Adhogati, Tiryagati. How they are disturbed. Huh? That we have to consider. Then Roga Marga. Important topics. Please write down SAQ, Doshagati. Important question. Doshagati. Always they ask. If it is not taken by me, you can inform me, sir. Please, this is not, we have not discussed. Discuss again in detail. Doshagati, Vyadhi Marga. Vyadhi Marga, you know, the Koshtha Vyadhi, then Shakha Vyadhi, and then Marmasti Sandhi. That is the third part of the Vyadhi. So that is a Roga Marga. Then Roga Avastha, stage of the disease manifest. Avastha, Ashukari Avastha, acute condition. Chirakari Avastha, chronic stage. Acute and chronic. Avastha, Samavastha, Niramavastha. These are the Avastha. Give the examples. Please write down examples. This Roga Avastha. Two examples I have given. Write down. Ashukari Avastha. Ashukari is equal to acute. And Chirakari, that is chronic. Write down another example. Samavastha. And another word is Niramavastha. Nir, without arm. And last is a 13th point. These are all Samprapti Ghatak, Vyadhi Ghatak. Very, very important for both. It may be SAQ or it may be LAQ, 15 marks. Then you have to describe a lot. So that is Sadhya, Sadhyatva. Sukha Sadhya and, Sadhya, Asadhya. Two types of Sadhya, Sukha Sadhya, Krichra Sadhya. And in Asadhya, Yapya and Anupakramya. I hope you have understood all these Nidana Panchak very nicely. Nidana, Purvarup, Upashay, Samprapti, etc. Okay? Now, last 3 minutes, I am giving you Roga Nidan Vikruti Vijnana, paper 1, index topics, very important topics. Not very, but we have to always hammer. There are totally, I will say, 5 chapters are there in my book, 5 chapters. There are time, so you write down number 1, chapter number 1. Dosha Dushchadi Vijnana. Paper 1, Roga Nidan. Dosha Dushchadi Vijnana. Write down. Quick. Number 2. Vyadhi Vijnana. Third chapter. Basic pathology. Dash, you write down modern, MODERN. It is not Ayurvedic. Third chapter is totally modern, basic pathology. Fourth chapter that we have learned, Nidana Panchak. Fifth chapter, Pariksha Vijnana. Pariksha, Trividha Pariksha, Chaturvidha Pariksha, Ashtavidha Pariksha, Dashavidha Pariksha. Pariksha Vijnana. Clinical examination. I have the fantastic mobile app. You can see all the videos. Nervous system examination, cardiovascular system examination. Yes. Some people are new. For them, I have the mobile app, different programs, Google Play. You go to Google Play Store. Type Ayurveda Academy. You will get my typical symbol and my phone number 9226810630. Click it. Then you will find there are 13 programs. Very interesting. Some medicine classes are there. X-ray interpretation is there. Clinical examination is there. Sex education is there. Lot of, then herbal plants are there. Ayurvedic medicines. These are the programs and very cheap. 300 rupees, 400 rupees, 200 rupees. You go outside for ECG interpretation seminar. Charge you 5,000 rupees, 10,000 rupees. In Deshpande is taking hundreds. Okay. So, but you must utilize those facilities. But today we have a very fantastic lecture. Tomorrow we will study the Stri Roga Prasuti Tantra and then Bala Roga on the Wednesday. So thank you very much. Take care and good night. Bye-bye.